This brings me to another person who I just have had a wonderful relationship with for many, many years. In the 1980s, I was asked to become an editor for a magazine called the Reece Report. Reece Report was the newsletter of Dr. Richard Reece, a pathologist practicing in Minnesota, who had spent many years as the editor of the Minnesota Medical Journal. And what impressed me was, as a conservative who had spent a lot of time in politics and had a lot of presuppositions about how healthcare was done, was the practical lessons of reading Reece Report as I was helping him prepare it about the practice of medicine, about the business of medicine. I remember him saying, this is something doctors didn't used to talk about. We didn't talk about the business of medicine, we just practiced medicine, and that was all changing, as you know, and I don't have to tell you the history. And Dr. Richard Reece has been in the middle of this for over 40 years, writing about healthcare, writing about the progression of healthcare, the movement into managed care and HMOs, and on and on and on, every conceivable crazy idea to tell the doctor how to practice. And so when we put this presentation together, I urged my friends at AAPS to allow us to invite Dr. Reece here to share with you today. And I'm really glad he's doing this. Dr. Reece now lives in Hartford, Connecticut. He is still writing every day. If you've never seen his blog at Med Innovation, you need to do that. Is it over 3,500 entries now? And in your package, you're going to find the interviews that he did with several of the doctors who are here to talk to you today. Remarkable man. I'm going to ask him to start his journey up here. Dr. Reece from Hartford, Connecticut. You can read all of his credentials from Duke University and his residency and his practice in the introduction. I just want you to know that I count him as a friend and my mentor. Will you welcome Dr. Richard Reece?
First of all, I have a confession to make. I'm a pathologist, and that's somebody who knows everything, but it's too late. I hope to erase that image today. Thank you, Dave. After that introduction, I can hardly wait until I see what I have to say. Let me begin with a series of thanks. Thanks for to Jane Orient, Executive Director of AAPS for the last 25 years, for her directness and clarity of thought. Thank you, Jeremy Snavely, her assistant with whom I've had many fruitful conversations, and of course with Dave Racer, a fellow conservative, and who helps organize the Survive and Thrive conferences. But most of all, thanks to 6 pioneer heroes in the direct pay movement who I personally interviewed. And they are Doctors Jane Orient, an internist from Tucson, Doctors James English and Donald Gehrig, Twin Cities internists, Keith Smith of Oklahoma City, an anesthesiologist and founder and director of the Oklahoma Surgical Center, Joss Umbraer of Wichita. His partner is here today, Doug Nunemacher, and Doug will talk to you later. And Lee Gross of Northport, Florida, who's a family physician. And finally, Dan Goldberg of Manhattan. That's Manhattan, New York, not Manhattan, Kansas. An entrepreneur who founded and serves as director of the Free Market Healthcare Group, which is why we are here today. And finally, thank you to Dr. Richard Ammerling, who will be the next president of this organization, who on July 4th, 2013, set the stage for this meeting by writing a piece called The Physician's Declaration of Independence. Let me begin by saying I am your advocate and your cheerleader, and this is a pep and prep talk. Not that you need me. You are highly motivated, and I know you can do it. You can do what you can conceive and believe in, and you will achieve it. And many of you have already become direct pay independent practitioners. I am glad to be back in Minnesota, the land of 10,000 lakes, 10,000 physicians, and 10,000 memories. I practiced here in the Twin Cities from 1965 to 1990. My wife and I raised 2 sons here, and I had a farm here where I developed my sense of humor and was a man outstanding in my field. And as an aside, I was the owner of a private laboratory, which was the largest one in Twin Cities, and then I became aware of the incongruities of the system. We were charging $6, usually with a 20% discount, for a comprehensive chemistry profile, and the hospital where I practiced was charging $84 for exactly the same test, and that struck me as bizarre. I also witnessed here the creation of United Healthcare, which, by the way, was created by physicians, and that was created in the 1970s. And I wrote a 1988 book, which is for sale in the back, and it was called "And Who Shall Care for the Sick? The Corporate Transformation of Medicine in Minnesota." That transformation has since occurred throughout America. Before that, I wrote another book called A Collection of Editorials from Minnesota Medicine, 1975 to 1982. You can get a copy of that in the back. It's a courtesy copy. You don't need to pay for it. I apologize for the humor in that book, which contains a piece called, quote, "Warming Up Cold Statistics, How to Talk to Floridians About Minnesota Winters," of which the Miami Herald commented, "Now we know why the Minnesota state bird is a loon." To make a long story short, Minnesota Medicine received 1,000 requests for my editorials, which was unprecedented. And in these books in the back, you can read about why that might be so. At the time, I was attending in 1975 a conference promoted by the Harvard Business School, and there were 60 of us which were dubbed healthcare leaders, and the thing that struck me was I was the only doctor there, and they were going to lead us to nirvana. In 1975, perhaps you've forgotten, universal coverage and national health reform seemed imminent, and that's why Senator Edward Kennedy organized this conference to lead the American health system out of the wilderness. And Senator Kennedy said of this inevitable dream, and memorably I might say, quote, "For all those whose cares have been our concern, the cause endures, the hope still lives, and the dream shall never die." The dream being universal coverage subsidized by the government. The universal dream remains elusive, and it could possibly die with the November elections. But physician subjugation is in full swing. In my 1988 book, I warned of a future physician shortage. That shortage has come to pass in the neighborhood of 50,000 shortfall of primary care physicians. and independent practitioners are in short supply. I warned of the collective power of big organizations and big government and the diminishing role of independent physicians. Today, managed care and big organizations dominate the Twin Cities practice scene. Less than 10% of physicians are in independent private practice. Hospitals and large physician groups employ most of the physicians here. Organizational dominance is ever present today in the United States. Today, United Health, the nation's largest health insurer, has $24 billion in annual revenues. Remember, this was organized by doctors. George Halverson, who I debated in the 1980s, who was CEO of Health Partners, a big group here, moved on to become CEO of Kaiser Permanente, headquartered in California, which has revenues of $50 billion a year. CMS has a budget of over $1 trillion for Medicare and Medicaid this year. And the Office of Management and Budgets predicts that Obamacare will take $2.5 trillion to fully implement. Oh well, $1 billion here, $1 billion there, $1 trillion here, $1 trillion there, and pretty soon we're talking about real money. But the exodus from private practice continues. Doctors are retiring early. They're seeing fewer patients. Hospitals now employ more than half of the doctors, and half of the doctors are not accepting Medicare or are restricting access to Medicare patients, or not accepting Medicaid, I should have said. Unfortunately, we doctors lack a central organization that unifies us, and we remain independent. But even without promotion and unification, you, the members of this audience, are part of an incoming, growing wave. It is a spontaneous, countervailing, incoming wave, largely underreported and unnoticed. The wave is cresting and splashing and lapping and breaking upon the healthcare beaches, but you don't hear much about it. It is a macro wave, not a microwave. According to the American College of Private Physicians, there are now 27,000 doctors in direct, independent / concierge practices and 80,000 in cash-only practices. Add that up and it comes to 100,000 doctors of America's 900,000 who are now entering this movement, this wave. Why is this? To me, it's because direct pay independent practice is personal for physicians. You're freeing yourself up from the personal burdens of spending 25% of your time coding, entering data, doing hassle-packed work, or otherwise complying with Obamacare for third parties and insurers. And 50% of your overhead results from complying with these regulations. For these reasons, I call what you're doing the 25/50 practice freedom wave. It is personal for physicians too. Patients want to spend more time with a personal doctor. They want a doctor dealing directly with him. They do not want a doctor glued behind a computer screen, gathering data, staring hypnotically at a computer screen, interrupting them every 10 seconds, looking anxiously at their watch so they can process the patients for that day to make ends meet. They feel they're on the hamster wheel, constantly running but never getting anywhere. Spending time with doctors for patients is personal. It was personal for the 6 people I interviewed to prepare for this talk. And from that talk, I learned a series of things which I was not completely aware of. You can make the conversion to direct pay independent practice. You can do it in many ways. You can charge a retainer annually or monthly. You can be paid cash for each episode or each procedure. You can create bundled bills for your practice covering all eventualities. You can do it through primary care or specialty care, and you can do it by slowly layering a concierge model on a traditional practice while making the transition to a third-party free practice. And you can market your practice online. The difference between now and the past, to me, is the computer and the availability of online information. And you can do it through sheer courage, by getting your priorities straight, and by having convictions. These convictions include your belief in the power of the free market, in the power of personal care, and in the power of getting your priorities straight. And the main priority is to serve the patient before you serve the needs of third parties and government. From those I interviewed, these 6, I call them pioneer heroes, I learned these lessons: transparency, constancy, and creativity. 1, transparency. Make your prices transparent up front so patients and payers will know exactly what to expect. Bundle your services into one global package so no surprises will be forthcoming. 2, constancy. Have a common and commonsensical electronic health record. Dr. Umbacher in Wichita and his partner have developed a common record for people who want to practice concierge medicine. And be constant in your attention to your patients. And thirdly, develop creativity. I have a book out there, by the way. I wrote a book called Innovation-Driven Healthcare, and it's available out and back, and I give 34 examples of these innovations. You can use software to create websites. You can use it to instruct your patients. You can use it to market your services, and you can use it to engage patients in their care and to inform them. I learned from these 6 individuals the power of partnering. And I have 5 points here. You can partner with other physicians to form networks of physicians linked to businesses, particularly businesses with health savings accounts and high deductible plans. You can use it to partner and consult with these business payers to lower their health cover expenses and the problems of their workers. You can use it to partner with hospitalists and hospitals to create bundle prices for episodes of hospital care backed by reinsurance. I did this in Oklahoma City, where I was chairman of a PHO. We developed 150 bundled prices for hospital procedures using funds from both the hospitals and the doctors. It never caught on. It was before its time, but it is possible because I have done it. You can use it. You can partner with physical therapy groups, labs, imaging centers, pharmaceutical firms, and specialists who offer direct pay discounts for the patient, in the process lowering costs for the whole system. And lastly, and mostly importantly, you can partner with each other, as you are doing in these Survive and Thrive meetings. From these interviews, I learned that health exchange plans, namely Obamacare, have provided an unexpected opportunities. I kept hearing this repeated message from those I interviewed. These health exchange plans in general have high premiums and high deductibles, and they're associated with thousands and millions of health plan cancellations. These two events, the cancellations and the high premiums and deductibles, have generated a whole new line of business for direct pay independent practice. Everyone I talked to said patients are coming to them because they're tired of dealing with the bureaucracy. Their new patients include the uninsured, the insured, and the uncertain, all seeking timely, confidential, convenient, and hassle-free care. Many of whom I talked were surprised by that because they had constantly heard the message that concierge medicine is only for the affluent, and yet few of the affluent were coming to them. There were these other groups of patients unable to deal with the complexities and the delays of Obamacare. Finally, I share with you 6 fundamental priority principles as articulated by Peter Drucker, a conservative economist. And these 6 are: courage rather than analysis dictates the truly important rules for identifying priorities. So have courage. 2, pick the future against the past. The future we will see after the November elections, in which 85% of the pundits say the Republicans will probably capture the Senate. And after that, we don't know the future of Obamacare. He will certainly veto anything that's replacement or repeal, which will not occur. Number 3, focus on opportunity rather than problems. The opportunity is here to serve patients, to spend more time with them, and to follow your own convictions. And 5, choose your own directions rather than climb on the government bandwagon, and aim high, aim for something that makes a difference rather than something that's safe and easy to do. So ride the wave. You can do it. Go for it. Have fun. Stay on your feet. Spit out the salt water if you fall. Rise and try again. And keep these 4 Mayday realities in mind. 1, a health law that requires 2,700 pages to explain is expensive, confusing, complex, and may be inexplicable. 2, a health law that requires 2,500 new regulations spanning 10,535 pages and consuming 1.15 million words to enforce may be unenforceable. 3, a health law that requires $2.5 trillion, that's the Office of Management and Budget's estimate, may be unaffordable for this nation. And finally, a health law opposed by 95.5% of the people in 435 consecutive national polls since 2009, with 65.3% opposing it by double digits, may be politically untenable and unsustainable. Good luck and happy surfing. The nation needs you, the patients need you, and you need each other.